Hi there. Thanks for joining me. My name is Janelle Hickman. I'm a dental hygienist. I've been working as a hygienist for 16 years. I've practiced hygiene in the states of California, Oregon, Idaho, and now Utah. I've seen a lot of people come into the dental office with dental related diseases. In Utah, I've seen a lot of people with cavities. I'm going to talk to you today about tooth decay, or also known as cavities. This is a dental related disease that can be prevented. Specifically, I'm going to talk about an effective way to prevent cavities. This effective way is through water fluoridation. The Centers for Disease Control considers community water fluoridation one of the 10 great public health achievements of the 20th century. Did you know that all water has some fluoride in it naturally? I'm talking today about adding fluoride to the community water to the optimal level where fluoride can help protect our teeth and prevent cavities. The amount of fluoride that needs to be in water to prevent tooth decay is 0.7 milligrams per 1 liter of water. This is the amount of fluoride that has been proven to reduce dental cavities and is safe in drinking water. Water fluoridation has proven to reduce tooth decay by 40 to 70% in children and prevented tooth loss in adults by 40 to 60%. Water fluoridation safely and inexpensively benefits both children and adults by effectively preventing tooth decay, regardless of status or access to dental care. Now, this is not saying that we aren't going to get cavities. We still need to brush and floss our teeth. We also should limit the sugar exposure in our diets to prevent cavities. Fluoride protects teeth by making them more resistant to acid. Our mouth contains bacteria. That bacteria creates an acid when it combines with the sugars in the foods we eat and the beverages we drink. The acid that is produced harms and damages our teeth. As people consume more sugars in their diets due to continual added sugar in foods these days, the acid exposure in our mouth is going to be constantly high. Fluoride can aid in prevention of acid breakdown to our teeth by making our teeth stronger. There are other options for fluoride other than in water. For instance, our store-bought toothpaste, but that is a very low amount of fluoride, and we need more fluoride exposure than that. There is prescription fluoride toothpaste, which is a great option, but can be expensive. Prescription toothpaste can cost about $20 a tube. There is also fluoride tablets for children only while their teeth are developing. The tablets are a prescription, which can also be expensive. Water fluoridation is a way more cost-effective method that benefits everyone. It only costs $1 per person per year. For most cities, every dollar invested in water fluoridation saves $38 in dental treatment costs. The other day, I had a mom come into the dental office I work at with her 10-year-old son. Her son was in pain from an infected tooth. The tooth had a bad cavity in it, and the tooth couldn't be saved. Luckily for the boy, it was a baby tooth. Still, this boy was in pain and had to have a tooth pulled because of a cavity. The boy was very scared and started to cry before anything was even done. The mom was in distress because her son was scared and crying. The mom asked the dentist, "What can I do to help my son? He always has cavities. We're always coming into the dentist for some type of tooth emergency." I told the mom about fluoride and how that can help. But because Utah County doesn't have the optimal amount of fluoride in the water to prevent tooth decay, her son will have to get fluoride through toothpaste or a fluoride tablet that can be prescribed to him. The mom seemed relieved that was an option. Even though fluoride can help even now, the damage has already been done. If there was the 0.7 milligrams of fluoride in the water that the boy drank, this could have easily been prevented before it got to this point. The more cost-effective solution is community water fluoridation before it becomes too late. Communities in Utah County need to consider the possibility of adding fluoride to their water source as a cost-effective preventative aid in tooth decay. We need to do it now before it's too late. Thank you for listening, and I hope you gained some knowledge about the benefit of fluoride being added to the water source. It can be helpful at the right amount to help prevent cavities for ourselves, for our children, and for our communities. Thank you. Other resources are www.ada.org/en/public programs/advocating for the public/fluoride and fluoridation /5 reasons why fluoride in water is good for communities.